Hi, everyone. So today we're going to go over complications of surgery. So you might wonder why we don't celebrate when someone's going into surgery. Like they're getting fixed. So what's the problem? Well, there's complications that can happen. So we're going to go over a few of those today. So like I said, our main objection is by the end of this presentation, you'll understand why we do more worrying than celebrating when someone is going under surgery. And we'll cover many different complications that can happen during and or after surgery. So I should warn you, there will be graphic content. I will tell you to close your eyes if you are a bit squeamish, but I just wanted to let you know that it is in here. So viewer discretion is advised. So the first thing that we're going to talk about is complications with anesthesia. So anesthesia is a general term for the medication to put someone to sleep. So when you undergo surgery or any kind of surgical procedure, they give you some kind of anesthesia, usually knocks you out, you don't feel anything. So some symptoms that could happen afterwards are like dry mouth, vomiting, dizziness, nausea, tiredness, headache, sore throat, shivering, and mild hoarseness. But then there are also some severe reactions like stroke, heart attack, brain damage, and death. So we will go over later some conditions that kind of increase your risk for those severe reactions to the anesthesia. So anesthesia usually looks something like this. They either have like a mask that has the anesthesia in the form of a gas and it puts you to sleep, or they can use IV fluids to put you to sleep. So next up, we have hemorrhaging. So basically, to hemorrhage means bleeding. So if a patient loses too much blood, it can cause them to go into shock. So up here, as you can see in my little cloud, shock happens when there is a sudden drop in blood flow throughout the body, which results in the organs losing blood and oxygen because blood oxygenates our body. So some treatments can include IV fluids, blood transfusions, or further surgery to stop the bleed. So I have a picture here of intracerebral hemorrhage. So as you can see, this is like the brain, cerebral. So this is an image of a brain bleed or a brain hemorrhage. So right here, this little like lighter spot is the bleed. And if you want a more animated picture, you can see it here. So this is the brain, and then this is the area of the hemorrhage, and it's pressing up against the ventricle. I do have a video of hemorrhaging happening in surgery. So when I just want you to close your eyes. It's not, you can't hear anything. So just close your eyes and I'll let you know when to come back, when to open them back up. Okay. Your eyes aren't closed, definitely close them now. So as you can see here, we nicked the blood vessel. Yikes. And then that's basically what a hemorrhage is. And you just want to make sure that you can control the bleed because you don't want to just leave that bleeding. As you can see, a lot of blood gushes out. Okay, welcome back, guys. You can open back your eyes. So the next complication that we're going to talk about are DVTs, or deep venous thrombosis, or also known as blood clots. So due to surgery, the body naturally clots to stop from bleeding. That's a really important part because you don't want to just be bleeding out everywhere. So your body naturally clots. But sometimes they continue to clot even after surgery. So usually you might get a blood clot and it starts in your calf, but these are very dangerous because they can travel. So as you can see in the picture, like you have like your blood and your blood cells, they're going through, but then all of a sudden they start clotting, because they don't want you to bleed. But then it makes it, number one, it makes it so the other blood cells can't go through, but also it can break up. And that's what you see in this like little third picture here. So this blood clot is now half the size because now it's traveling through your veins, which is dangerous because then that can go to places such as like your brain or your heart, and that's very dangerous. That could kill you. So treatments for this consist of anticoagulants, which is basically like a blood thinner. So I like to think of Xarelto, if you ever seen the commercials for it, or baby aspirin can also be a form of an anticoagulant as well. Moving on, we have wound infections. So surgery is just a bunch of deep cuts, really. So just like your scraped knee can get infected, if you're playing on your bicycle and you fall down, so can your incision site. So always be sure to give the surgical site love by cleaning the wounds and changing the dressings regularly. So I'll show you an animated picture of what it looks like. So you have like skin here. This is underneath the skin showing you, and this is the infected area. And in here is a lot of bacteria, which is like that purple thing, but there's also pus, which is just white blood cells. So that's what you see. That usually, whenever something's infected, sometimes it looks like green or like white, and it's like pussy kind of thing. Those are the white blood cells and the bacteria. Now, if you are squeamish again, close your eyes, because I just want to show a picture of a wound that is infected. So close your eyes now, please. So as you can see, this is a wound that is infected. If you notice, you can see like the yellowness and like the discoloration. That's definitely a telltale sign that you have an infected wound. Also, if the patient has a fever or the incision site is really hot, that's another way to tell you that it's infected. And depending on what it is, doctors might have to go in, or you can get antibiotics. Okay, you guys can open your eyes. I stopped it. But yes, so if it's something like a wisdom teeth and your wisdom teeth get infected, okay, they might prescribe you, I don't know, clindamycin or any other kind of antibiotic, amoxicillin, and it'll be fine. But in some cases, if the infection is really bad, and depending on the type of surgery that was performed, they might have to go in and redo it. So that's that. So next up, we're going to talk about postoperative lung infections. So laying on your back for an extended amount of time without taking deep breaths is really bad for the lungs. The lungs aren't working to their full potential, so your oxygen levels drop. But then, as in our cloud bubble, we learned that low oxygen levels can put you at risk for developing pneumonia, which is basically an infection that inflames your air sacs, and it makes it very difficult for you to breathe. You might have a cough with it. So these are just chest x-rays of what it looks like. So this first one, A, is a normal picture of your lungs. You have, oops, I apologize about that. It's a normal picture of your lungs. You have your heart. These are your rib cage. Like these are your ribs. And these little sacs right here are your lungs, believe it or not. You just can't really see because they're kind of like, they look almost hollow. But now if you look at B, C, and D, it shows you the different types of pneumonia. So bacterial, viral, COVID-19 pneumonia. But if you notice, it kind of looks like, to me, it looks like there's like smoke and like fog in there, but that's really just the inflammation of your lungs showing. You can also see, if you look closely, like your vertebrae, your spine. I think that's pretty cool. Okay, so now what conditions increase your risk of complications? And we talked about, the severe reactions with anesthesia, such as like stroke and stuff. So what exactly increases your risk for that? So if you have heart disease, the anesthesia can actually depress cardiac function, and that can put a strain on your heart muscles. So that'll increase your complications in your surgery. Having hypertension, which is another word, which is the fancy medical term for saying high blood pressure, you can have a stroke. Your risks are increased for having a stroke. If you have any type of bleeding disorders, hemorrhaging is also going to become increased. And remember, hemorrhaging was like uncontrollable bleeding, basically. Obesity can affect your wound infections, so it'll increase your risk there. If you have any lung conditions such as COPD or asthma, the anesthesia can decrease your respiratory function. So obviously that's not exactly the best, so it'll increase your risks of complications there. If you have diabetes, that'll affect your wound. So not only could it possibly get infected, but it also might take longer to heal. So if, the average rate for a healthy person to heal is 6 weeks, it might take, 6 to 10 weeks for someone who is diabetic to heal, or it might have problems healing properly. And then if you have kidney problems, that also puts you at an increased risk of having a stroke. And then smoking as well, that also has to do with the lungs. You want to make sure your lungs are as healthy as possible. If you're putting, tar and tobacco and all those really bad products into your lungs, nicotine, it's going to put you at risk. Thank you so much. I hope that you learned a lot today. If you have any questions, you can email me here, or you can leave a comment on my blog and I'll be sure to get back to you. And it'd be nice if you can just tell me, like, what did you learn? Did you learn something new today? Sorry. Like, what did you learn? What did you find interesting? Maybe not interesting. Just Hearing some feedback. Thank you so much, and I hope you enjoyed this. Have a good day, guys. Bye.